another budget battle with Congress. This time it would impact the city's healthcare system. House Republicans are considering a proposal that could cut $1.1 billion to D.C.'s Medicaid funding. City officials are warning that this would impact all residents and even our neighbors in Maryland and Virginia. Rafael Sanchez Cruz has the breakdown of how this could impact you at home.
When she was born, hold out your hand, she was this small. That's how big she was. That was it.
Ward 8 mother LaJoy Johnson-Law says her 13-year-old daughter Abria is her miracle child.
She does have special health care needs, though. She has chronic lung disease, she has epilepsy, she has a cardiac condition.
All services paid for by Medicaid and services that are at risk if Congress decides to cut the federal funds provided to D.C.'s Medicaid system.
This is not a red state, blue state issue. This is a issue of, do we want to have quality health care in the nation's capital or not?
Mayor Murrow Bowser talking about the GOP proposal that would cut the federal funding for D.C.'s Medicaid from 70% to 50%, changing a formula that's been in place for nearly 30 years.
So the question is, can the district replace that $1.1 billion with local funds? The answer is no.
City officials say it would be a $1.1 billion hit, and the impact on services could be more than double, according to city officials.
It's a domino effect. So when one hospital has to pull back, it's going to then have a trickle over impact on others. And I'm talking about emergency room backlogs. I'm talking about elimination of services.
Children's National Hospital says the cuts would be immediate and devastating.
Our emergency center visits, 70% of the visits that come through are covered by Medicaid.
The cuts would even impact D.C. Fire and EMS.
We provide great care in this city, and they wouldn't do this in their home jurisdiction.
Chief John Donnelly taking aim at the Republicans in the House Energy and Commerce Committee, who's considering the proposal that some say targets D.C. specifically. House Republicans have insisted they're trying to, quote, normalize the amount of money D.C. gets.
This would be a drop in the bucket. This change for the federal government wouldn't close any gaps, but it would close hospitals in the district.
That was our Rafael Sanchez Cruz reporting. How soon could the district see the impact of the potential cuts? Well, Mayor Bowser says she's unsure and she doesn't want it to get to that point. This proposal could be taken up by the House Energy and Commerce Committee as soon as next week. We'll let you know what happens. Turning now